All right. Welcome everybody to the Young Neurosurgeons NREF webinar. Today we are going to talk about grit, resilience, and neurosurgery training with two very distinguished guests and several of our Young Neurosurgeons panelists. This is episode number 8. So many of you may have seen all of this introduction before, and if so, I might apologize. But for those of you who may not have, the goal of this is to provide students and residents, young neurosurgeons, with timely information, education, and to some degree inspiration towards a career in neurosurgery or paths within neurosurgery. In case you don't know what Young Neurosurgeons are, we're a committee of the AANS, and our goal is to develop future leaders in neurosurgery and provide a channel for young neurosurgeons to impact the direction of our specialty. What is the NREF, you might ask? It's a lot of letters strung together. It's the Neurosurgery Research and Education Foundation. It's a 501c3 not-for-profit organization created by the AANS, the American Association of Neurological Surgeons. Their goal is to support basic science, clinical research, as well as lifelong education to foster improved outcomes for patients with neurological diseases. And they also fund a lot of resident education courses and the like, including this one. So thank you for their support. Before we get started, I want to remind everyone, I won't be this coming week because there's a break for Thanksgiving, but in December 3rd, we'll have our next episode of the webinar, which is about spine and why these prominent and folks who love their jobs went into spine surgery, when maybe why you want to as well. That'll be with Dr. Nicholas Theodore, and who's a former Young Neurosurgeons member, as well as Dr. Khoi Tan, who is a former Young Neurosurgeons vice chair. And that'll be on December 3rd. You can find out details and the links for registration on the Young Neurosurgeons social media, which you see the handles there, Twitter and Instagram, at Young Neurosurge or at Young NeuroS. If you signed up for this webinar, you should get a prompt and a link in your email as well. Our featured guest today, Dr. Elad Levy, who is the professor and chair of neurosurgery at the State University of Buffalo in New York, State University of New York at Buffalo, I should say. He's the L. Nelson Hopkins Endowed Chair of Neurosurgery. He's the medical director of neurovascular services. He's a co-director of the Gates Stroke Center. He's very well known as a chair, as well as a very well published cerebrovascular and endovascular neurosurgeon with over 300 peer-reviewed publications, numerous book chapters and lectureships, etc. Welcome, Dr. Levy, and thank you very much for being here.
Thank you.
Dr. Reynolds is also at the State University of New York at Buffalo. She's actually an associate professor, I believe. I may have gotten that wrong. I'm sorry if that's true. Associate professor of neurosurgery, the residency program director at University of Buffalo, the medical director, pediatric neurosurgical outreach and education, Dr. Renée Reynolds. A huge pleasure to have both of you here. Thank you for coming. Looking forward to hearing your talks. Sorry, I know you're muted. Our panel today, I was just talking to our speakers. 2 of our panelists have had last minute conflicts and really wanted to be here. So Dr. Dornbos and Dr. Graffeo, who is Dr. Dornbos, the cerebrovascular fellow at University of Tennessee in Memphis, and Dr. Graffeo, chief resident at Mayo Clinic in Rochester, are probably not going to be able to join us, maybe later in the session. Dr. Majmundar, however, also one of the Young Neurosurgeons members, is going to be able to join us, as well as Dr. Linzey. Dr. Majmundar is a PGY6 neurosurgery resident at Rutgers in New Jersey, and he will be doing an endovascular fellowship over at the Barrow. Dr. Linzey, neurosurgery resident, PGY2 at University of Michigan. Thank you both for coming and welcome. Finally, someone who does a lot of the hard work behind the scenes and one of the people that helps make this possible is Anna Rodriguez, who's also on our panel here, who will help us with the question and answer session. So please, if any of the viewers have questions, there's a question and answer function in Zoom, put them in there and we'll try to get to them towards the end of the time. With that, we will have Dr. Levy or Dr. Reynolds, whoever has elected to go first in their parts of the talk, share their screen. I'll stop sharing mine. And we look forward to hearing about this really interesting topic, which I know has had a lot of internal excitement in our committee about this particular webinar. So thank you for spending the time to talk to us.
Well, Dr. Johnson, thank you for inviting us to share some of our thoughts with the Young Neurosurgeons Committee and its membership. So when we talk about grit and resilience, I think probably some of the lessons I learned most about grit, which are applicable not only to life, but especially to life as intense it is when we are in neurosurgery training are lessons I learned around the boathouse when I was a rower at Dartmouth College. So we'll take 15 or 20 minutes to talk about how these lessons translate around grit and resilience for neurosurgeons in training and really throughout our career. Let me forward the slide. Okay. No relevant disclosures for this talk. When we talk about some career advice for neurosurgeons, and I've referenced this before on my social media, nice article about grit and burnout by Juha Hernesniemi from Helsinki. And what does he say? So if we just look at the words in red, what helps us sort of become gritty and helps us to create resilience? So he talks about dedication, determination. People are full of energy. They really just uplift the room when they walk in. He talks about being young, and I don't necessarily think it has to be young chronologically, but young in the mind, meaning plastic, pliable, almost sort of wide-eyed and willing to drink in information and be inquisitive. I think that's what young means there. Throughout their entire life, kind of that young intellect, intelligent, flexible, get along with people, different people, yet be stubborn and tenacious in at least your goals, your desires, your willingness to improve healthcare in neurosurgery. That's where stubbornness and tenacious is actually a benefit when it's about fulfilling your goals. Be willing to travel, not only travel to lecture, but travel to learn. He talks about being fluent, but not again fluent. I don't interpret this fluent in languages, though I do think that is important for brain development, but fluent in learning the language of neurosurgery, of endovascular, of spine, of functional neurosurgery. So you will learn different languages, different ways of interpreting the information you get as you train. That is a new kind of fluency. Learn new ideas and techniques, hardworking. Clearly, this is a surgical subspecialty, one that often requires significant intricacy, so you need to have good hands. I strongly believe that good physical condition pairs well with a healthy mind. You hear that? Healthy mind, healthy body. In the end, he also talks about neurosurgery not only as a passion, but as a hobby, meaning when you're not at work, if it's truly your hobby, you're doing it in your off time, you're thinking about it, you truly love the craft, and that's what creates passion and interest in the field. So a great paper given to me by actually one of our residents, Justin Capuzzo, by Juha, which again, I've cited before, easy to find. So what are we going to talk about today? Some of the issues that build grit and resilience is understanding your background, understanding your foundation, and then building on it. You always hear, be honest about your strengths, play to your strengths, but also understand your weaknesses. And a former coach said, work your weakness 3 times harder. And that's not just in a gym or on the water. It means in the OR. If you have a certain skill set, don't just try to live in that skill set. In training, find your weakness and force yourself into that zone of discomfort and work it 3 times as much. Know your people. So know people that you're going to draw inspiration from. Know people who are going to help you accomplish your goals. Clearly, we all make mistakes. We continue to learn. We continue to make mistakes. So we have to be honest with ourselves, honestly assess these mistakes, because the difference between a mistake and a lesson is that we learned from our mistakes. That's what now makes it a lesson. We'll talk about development, the novice, not only as a resident, but people young in their career, and how developing the novice and selecting your own heroes, your immediate heroes in your immediate vicinity is critical to developing into the next level of a neurosurgeon. We'll talk about fitness, passion, and grit, and we'll talk about innovation. And then finally, we'll talk about the concept, not practice makes perfect, but perfect practice makes perfect. And we'll get a little more into that. So understanding the foundation and building on it. At one of the former CNS meetings, I had a chance to host Dan Brown, author of Boys in the Boat. Great story about young men from Seattle that go on to win Olympic gold during Nazi Germany. So how do a bunch of ragtag college kids beat a bunch of professionals all around the world and win the Olympics? because they came together as a unit, and like a residency cohort of neurosurgeons or a faculty or a group of neurosurgeons, whether it's faculty or in private practice, when they each understand each other's strengths or weaknesses. This guy may be a great grant writer. This may be an exemplary clinician. This person may be an excellent technician. When you understand the strengths and the weaknesses, then you understand the opportunities, that classic SWOT analysis. And then by building that team of residents, whether it's a researcher, a clinician, a technician, or your team of faculty, that's how you build championship teams. But you can't do that without understanding the foundation. And we all sort of have our favorite papers, and of the papers that I've been a part of, one of my favorites is simply a case report, because in this simple case report that was nuanced, it talked about testing the boundaries of neurosurgical innovation, but understanding where we came from. So this is and as Charlie Drake said, surgical ingenuity has no bounds in the search for other methods for obliteration of aneurysms, whether it's plastic coatings, thrombogenic hair, wire, iron, clip or ligature will remain the most effective. Well, I think today we'd argue that clips are not necessarily the most effective, though they are in some cases, but he is right that ingenuity has shown no bounds. So several years ago, about a decade ago, I had the privilege of caring for one of his patients. And this was a very unique patient. So this is the actual angiogram performed by John Alcock. And I know we have some people on the panel that are interested in endovascular. So Alcock test, carotid compression of the Alcock test by the famous John Alcock. So here is hand-cut angiofilm showing a giant basilar aneurysm. And this patient was the first awake Hunterian ligation that Dr. Drake did in London, Ontario. So he wakes up the patient in the middle after he ties off the basilar around the level of the SCA to see if he tolerates it. And he tolerated it. And that was his handwritten op note by Charlie Drake. Here's his letter to the referring doctor written in 1975 that says, this is the first time temporary occlusion of the intracranial artery has been carried out in a patient who is awake to test collateral circulation, and may be the forerunner of many more to come, and it was known for his Hunterian awake Hunterian ligations. Fast forward almost 30 years, here's the angiogram. He presents with recurrence of the aneurysm that had ruptured above the ligation. So you can see that clip that was in there from his old Hunterian ligation. So this was the first time we understood what was done. We understood how foundational this concept was, and then we built on it. This was one of the first cases, and the only case of going across a prior ligated basilar, but a trans-PCOM stent coil, which now, 10 years later, is, I would say, not uncommon, but at the time was very cutting edge and was published. So this patient made history twice. So to me, I love this case report because while it is only a case report, it sort of epitomizes understanding where we came from, and through that understanding, how as sort of young neurosurgeons early in our career or fellows, we can push the envelope and develop a technique which is now relatively not uncommon, which is trans-PCOM stent coiling. Know your people. Where do you draw your inspiration? Where do you draw your energy? Where do you actually, what do you want to avoid? Where do you feel, who makes you uncomfortable? So know the people around you, and whether it's drawing inspiration from your children, from your partner and your best friend here, Adnan Siddiqui, from my team of healthcare practitioners, from my co-residents. When I was a graduating chief at Pitt, this is Dr. Spiro, who after 20 years, who's joined me back now in Pittsburgh, we recruited him to run our trauma service. Whether it's from an innovative vintner, Paul Hobbs, who is a Buffalo guy, but has made some of the best wines, best California cabs now in the United States, if for any people who like California cabs. Or whether it's a team of fellows, know the people that are in your orbit and how they can inspire you to reach new heights. Learning from your mistakes. How do you build grit and resilience? Again, we all make mistakes. We hopefully, as we mature in our career, those mistakes are often less from judgment and maybe from other reasons. But when you learn from your mistakes, as I said prior, the difference between a mistake and a lesson is that you learn from it. So what we try to do here, at least in Buffalo, is what we call NFL game tape. We will record almost every case, or we'll record and review these cases same day, just like you review an NFL, a player may review his, you see with the Microsoft Office pads on the side, you see them on the bench, to, whether it's Tom Brady or somebody else reviewing the play on the bench. So we'll review the tape after the cases, because where we are today is not where we were yesterday, and it's not where we want to be tomorrow. So looking at this tape, what could we have done better? What should we have done? Where was the opportunity? And that's how next time we're faced with similar challenges, we improve. And these are the videos that we put into our books in neurosurgical clinical decision-making here in neurovascular disease, and in the video atlas, and in this other book on acute stroke management. These books are based on these game tapes, and hopefully the lessons that we learned when we review these tapes, we've tried to make available for anybody else who hopefully won't repeat the mistakes we made. And here we are, after we're reviewing tape, sharing some of the insights with our fellows, going over some of the videotape there. Same, whether it's rowing or this is a championship race, Ohio State takes her eye off sort of where she is, or loses focus. They were leading with about 200 meters to go, ejects from the boat, cost them a national championships. So game tape is very important. Lesson 4, developing the novice, selecting your own heroes. So, Nick Hopkins, former chair, definitely a mentor, a father of American neurosurgical endovascular pioneer here. Here he is. And as Darth Vader, the philanthropist, says, strong people don't put others down, they lift them up. But what Nick taught me was the freedom to make mistakes. While he was a mentor, he sort of gave me not enough rope to necessarily hang myself or really hurt a patient, but the freedom to make mistakes, compounded or balanced with altruistic advice. And that truly is the definitive mentorship. Let people make mistakes, but advise them along the way. Balance through tough love and accountability, but always unconditional support. And when you have that kind of unconditional support, yet with high expectation, that feeds into resilience. That is the opposite of getting beat down. That allows you to come back after a devastation in neurosurgery, or just after a very tough day, which we've all had, knowing that the people around you are going to show you that tough love and unconditional support, and the freedom to make mistakes again, which will happen in the future. So another mentor where I trained in Pittsburgh under Dr. Janetta, father of microvascular decompression. Again, to build grit and resilience, he'd say, give people the support they need, then get out of their way. And, I've taken, what I like to do is the greatest feeling in teaching medicine is when you can step out without looking back. Being able to step away from the surgical table here, or the endovascular suite, and just watch the residents really perform independently. And that is very gratifying. Again, so for me, my mentors who helped me create sort of grit and resilience in the endo and operative suites are Nick, Hopkins, Lunsford, and Janetta. And hopefully I've carried and been able to impart some of these lessons I've learned from them onto these next generations of our fellows and residents as they develop grit and resilience. As Ernest Nemi said, physical fitness is important. So we try to have biannual resident soccer games. Here's actually another co-resident from Pittsburgh who happened to be up in Buffalo visiting. First thing we did is we went for a run. Here's a our resident annual soccer game, biking, whatever it is. I truly believe we do sort of competitive spin classes. Being able to stay fit and kind of push the body a little bit is very important for that grit and resilience. So developing grit through physical activity translates to resilience of the mind. Innovation. What stops it every day from being the same? What breaks the monotony? What sort of breaks that mental fatigue is the excitement through innovation. And I think people know the Jacobs Institute here at Buffalo and the culture of innovation here. As Tesla said, I don't care that they stole my idea. I care that they don't have any ideas of their own. So challenge, right. As you saw, this was that case report we talked about. Every man owes it as a debt to his profession to put on the record whatever he has done that may be of use to others. Again, to quote from Charlie Drake. So our culture here in Buffalo is to, try one, innovate one basically, and write one. Versus see one, do one, teach one. It's innovate one, write one. So borrowing from the rowing analogies, oars used to be shaped like this. One day somebody came up with a design from concept to in New Hampshire to shape an oar like this based on physics. And Dartmouth, being in New Hampshire, was the first college to try it, and what happened to be the year we won a national championship. Not because we were bigger or faster or better than anybody else, honestly, it's because we were the first to embrace an outside the box concept of an oar. And I think that lesson stuck with me over the last 25, 30 years, that embracing something that may seem different or seem awkward is critical. And when we look at the stroke space, I will tell you, in 2001 and 3, when I was a fellow here, and in 2004, when we started lecturing about intervention for stroke, stenting for stroke. So Buffalo, we were the first FDA approved site to use stents for stroke. And that led to the concept of retrievable stents. And then we were the first to say that stroke is not based on a stopwatch. People often hear me say we're more sophisticated than a stopwatch. We need perfusion. We knew we were onto something because there were sort of 3 phases. The first phase was, we are cowboys. This is heresy. And if I had a tomato, Levy, I'd throw it at you. The next phase was, well, guys, maybe they're onto something. We should look at it. And when you really knew you did something right is when the third phase happened and people were saying, oh, we did that. That wasn't a Buffalo thing. We did that first. So have the courage, have the sort of tenacity, have the resilience to embrace and develop innovation. Test it. Test it smartly, of course, but test it. And finally, perfect practice makes perfect, which is why we've invested in a $500,000 simulator here for the fellows, and why we insist that the fellows practice carotid stenting or aneurysm coiling on a simulator before we let them do this on a patient. Because there's no radiation here, but we can 3D print models, as you see here. We can digitize anatomy here, and let people practice on real world simulated or 3D printed anatomy. And through practice, perfect practice, the same techniques, that translates into much better technical ability and a much more steeper slope of learning these techniques. So here's sort of more imaging of how we practice with stroke devices, removing clots, and all the simulation that we sort of work both with industry and with residents and with fellows here. So I'm going to leave it with 2 slides and then turn it over to my colleague and partner, Renee. Renee here was a senior author on the Burnout paper. She's going to probably go into it a little more, but we surveyed 106 neurosurgery programs, 1,200 residents, 22% response rate. Why? Probably most residents were burnt out and didn't want to respond. So probably burnout was higher than 36.5%. But compared to other residents and fellows, it was actually lower. There was 60% compared to other residencies. Early career physicians were around 50 to 53% for practicing physicians. And looking at, on a follow-up paper, the relationship of grit and resilience among U.S. neurosurgery residents and residencies, 1,300, almost 1,400 neurosurgery residents were surveyed with a 31% response rate. The burnout prevalence was 33%. High grit was associated with U.S. graduates, married residents. We can talk about that in either way. Maybe you have to be gritty to stay married. I don't know. And fewer social personal stressors. Maybe being married allows you to have fewer social and personal stressors, somebody to share these difficult times with. Higher resilience was associated with international medical graduates and fewer social or personal stressors. And finally, high burnout was associated with greater social personal stressors, as you would expect, clinical rotations, and lack of children. So a lot to unpack there, and we can unpack that on the panel later. I want to be sensitive to the time. But in summary, again, I truly believe to keep this field advancing, to keep it from stagnating, to keep it interesting, to keep resilience and grit. Understand your foundation and build on it. Draw energy from the people you choose to surround yourself with. Life is short. Be choosy with the people you surround yourself with. Don't make mistakes, but definitely have lessons. Have lessons. Develop the novice. Select your own heroes. Stay fit, even if it's 30 minutes a day. Just get the body sweating a little bit. Get your body moving, because I do think that fitness does improve one's own grit and resilience. Innovate, challenge the status quo, write and publish. Whether you're going to be a clinician in private practice or in academic medicine, if you're doing something that you think can help others, spread the word, write about it. And finally, never stop practicing. That's why they call it the practice of medicine, but perfect practice makes perfect, not just practice. So, and one final lesson is to keep your head in the boat. That's a quote you'll hear from a coach in every boathouse. And what does that really mean? If it's not going well in the OR or the angio suite or in the clinic, stay focused on the task at hand. Be resilient. Be resilient. Don't let your mind wander. Don't get distracted by criticism while you consider it. If you're truly passionate and you're stubborn, as Ernest Nemi said, and dedicated to advancing the greater good, keep your head in the boat. Thank you very much.
Thank you, Dr. Levy. It's outstanding. There's probably multiple hours of discussions could be had about that talk alone. It's really quite remarkably put together. So thank you very much for sharing all those things. I wonder if any of our panelists have any questions quickly for Dr. Levy before we go to part 2 with Dr. Reynolds. All right, Dr. Reynolds, I think you're up. We'll have a group discussion after both talks are done. I truly appreciate it.
Most welcome.
So my talk has a little bit of a different flavor to it. I wanted to make sure I was respectful of you guys and give you a little bit of a different flavor to the different sides of resiliency and grit. And so I'm talking more about building resiliency in residence and the residency curriculum. And I think first and foremost, spacebar did not work.
It takes a while. It's weird.
Okay. Oh, okay. First and foremost, I'd like to mention that I'm not an expert. I developed an early interest in burnout, and through that early interest, I had the opportunity of engaging in a variety of different things. Okay, something happened when you touched something over there.
That's weird.
Okay. Okay.
That's weird.
No. Okay. Technical difficulties already. Anyway, I'm not an expert, but I had an interest in burnout early on, and through some of the publications that Dr. Levy mentioned, it opened up avenues for me to further progress this interest. And a few years ago, Dr. Stippler asked me to be part of a CNS committee that was devoting time into building resiliency into neurosurgery, not only residents, but into the attending side. And the task that was given to me was to develop a curriculum for neurosurgery residency programs. Being that I'm not an expert, I really had to do a lot of research to develop this, and this just lists some of the resources that I utilized. There's a great book called Building Resilience in Neurosurgery Residents, a primer. And then a lot of the research that I did was into the military, and I'll talk a little bit about that. They have a strong devotion to building resilience within their training process. And there's the Penn Resiliency Program, which I'll touch on a little bit as well. And then just my own personal experience in trying to build resiliency into our residency training program. And I should mention that a lot of the things that I discuss are not necessarily things that I actively do right now. It's a graduated process of trying to get these into the residency training curriculum. I have intent and interest in incorporating all of them, but it's a slow transition. Sorry. Okay. So just to talk about what resilience is, it has many definitions, but the most common two that you'll come across is a phenomenon characterized by good outcomes in spite of serious threats, or the ability to adjust easily to misfortune or change. And if you were to ask many of the residents you either work with or yourselves, well, what's the definition of neurosurgery residency? sleep deprivation, physical fatigue, treating critical and complex disease processes. And through all of that, you're separated from the things that hold most value to you, your family, your friends, and your hobbies. So a neurosurgery residents certainly face through that, threats to their emotional, physical, mental health. And unfortunately, in our formal education process, we don't really give a lot of training about resiliency. We just sort of expect it. And so at the end, neurosurgical residents are not really equipped with the skills to succeed in the face of the adversity that they will encounter during their training and in their careers. Well, why should we even care? Equipping residents with the tools to promote resiliency and well-being really has so many positive attributes, not only to the resident, but the people around them, the training program, the healthcare system. It instills positive self-esteem. It establishes an important attribute for workers in coping with worksite adversity. It promotes increased job satisfaction. It enhances organizational commitment and involvement, and it reduces levels of burnout at the end of the day. And this ultimately positively influences not only the morale of the entire resident complement, but the programs in which they train and the healthcare system and the patients for which they provide that care. And again, a lot of this is derived from the military. So the military has recognized these individual and organizational benefits to building resiliency into their training process. And the military, from this perspective, is really an excellent parallel to the healthcare system. They have to be able to screen and then recruit and then train and then ultimately maintain a workforce that's capable of succeeding in the goals set forward to them, as well as to maintain those in stressful situations and ones that are not necessarily expected. And what the military realized is that there's deficiencies in the reactive model, meaning if you're waiting for the identification of a psychological stress and then subsequent attempts to repair those pathologies are attempting to be developed, that's not going to be as effective to the proactive approach of building resilient soldiers and giving them the skills to combat adversity before they even face it, so they're more prepared in the setting of it. And I thought this was really sort of important quote that I came across. Just as we educate our patients to be proactive and the benefits of exercise and diet on the development of their atherosclerotic disease, our neurosurgery resident workforce would benefit from education on wellness, leadership, and resiliency to prevent the development of negative responses in their vigorous training process. But there's a lot of fear about focusing on this, and I will fully admit that a lot of the elements of the talk that I'm giving are very cushy and touchy-feely, but I think they are important, and they're things that have been neglected through the historical training processes that people have been through before. And where does this fear come from? Well, maybe focusing on wellness and resiliency and burnout will create this weak neurosurgical workforce that can't live up to the standards of the path that's been paved by all the folks that came through it before us. And there's this fear that if you admit your burnout, or if people see signs of burnout, that that's really a malady of the lazy and the people that can't work hard or can't make it. But the reality is focusing on this promotes balance and success. It promotes professional behavior. Again, it increases engagement. And these coping patterns that are learned during training will hopefully persist throughout a provider's entire career. And in all actuality, those that are most likely to be burnt out are the neurosurgeons who are really committed and who are devoted and have a hard time leaving their patients and the work behind. So it's really important to build resilient residents now so that we can lead to resilient attendings later. So the formal program that I'm going to talk about has three main elements. And the first is assessment of individual wellness. The second is this formal resiliency training. And then the third is these individual learning models and resources to improve wellness in each of those domains. There are a variety of different assessment tools out there to look into one's own individual wellness. And if programs or people had interest in kind of monitoring their own wellness or the wellness of their residents, there's several different ones that are available online and free. There's the Connor-Davidson Resilience Scale. There's the Resilience Scale for adults. And when they talk about timing of doing these, they really talk about doing it before you matriculate into something that's difficult, probably yearly to track people's psychological fitness or your own personal psychological fitness. And then if you identify yourself or somebody that you're training with as being a more high-risk individual, you probably want to do the assessment more frequently. And then when we talk about this formal resiliency training, there's technically four components. So the first is that you want to teach the fundamentals of resiliency. and clarify common misconceptions. And that really includes 6 core competencies. So being self-aware, and a lot of what I talk about focuses on your awareness of how you perceive people and how you perceive situations and your internal biases, and then how you respond to those. And ultimately, those things influence how we leave at the end of the day, you know, our happiness and our optimism at the end of the day, which does also then in turn affect our resiliency and our grit. So our self-regulation and our impulse control, understanding the things that set us off, and that might be a higher risk situation for us as opposed to other people around us. Looking for optimism and seeing good in things and people, understanding mental agility and be able to be flexible in your thinking and considering different perspectives, and then your own personal character, as well as your connection and building relationships with people and your willingness to help and then ask for help if you feel it's needed. The second component is building this mental toughness and these problem-solving skills, and it focuses on what they call ABCs. And it's education on how to identify thoughts that are triggered by activating events, and then your reactions to those and the consequences that are driven from it. So A, can you recognize that activating event? B, what are your beliefs about that event? And then C, what are the consequences of those beliefs? And just to kind of segue into something that's probably applicable to many of you as neurosurgery trainees, here's an example of an activating event. So you're on call, you're a resident, you get your 5th consult in 2 hours from the ER to rule out shunt failure. You're annoyed, you're busy, you're getting multiple phone calls, you're trying to triage everything that's going on. Your ultimate belief about this event might be, well, listen, the prior 4 consults didn't really identify a concern with the shunt. I'm trying to balance all these multitudes of tasks. I'm becoming angered by these additional consults. They probably are going to not culminate into anything of concern. And the ER is just dumping these patients on me and wasting my time. And the consequences of that are you're going to provide suboptimal care to that patient. It's going to lead to a poor outcome. It's going to promote a lack of trust from the consulting team. It may threaten your training if you miss something really important in a patient that truly is having an issue. And at the end of the day, this ultimately just leads to more anger and more resentment about your circumstance and your situation. And again, you leave unhappy. So you have to get out of these thinking traps. And one of those is these jumping to conclusions. So for instance, well, that nurse who's calling me is always the nag. The patient's probably fine, I can ignore it. Or they always think it's the shunt. I'll see that patient later when I'm free and I've done all these other things. It's probably not a real issue. Second thinking trap is either magnifying or minimizing things. So you have a tendency to devote greater focus on bad events and lesser focus on good events. So ruminating about the bad thing that happened that day, instead of understanding what an influence and what a positive effect we had on the multiple other patients that we did help during the day, and realizing the value of the work that we're providing. And then the last thinking trap is this externalization, where you can blame others or external circumstances for the outcome of events. Well, you know, MRI didn't get the scan done in time, and then the patient was weaker. Well, was it our responsibility to make sure that that scan got done in a quicker fashion? And so if you reapproach that same scenario, there's this activating event. The resident gets their 5th consult in 2 hours from the ER to rule out shunt failure. If you can change your beliefs about that event, okay, so the prior 4 consults didn't identify a shunt concern. But if you ask that critical question, have I really gathered enough information about this specific incident to come to that same conclusion? And you have to realize this rash of consults is not related to you being a black cloud or having an incompetent ER resident. And that ultimately this ER resident is probably just concerned about the patient. Then you revise the consequences at the end of that activating event. You make the right diagnosis, the patient gets the best care, the consulting team trusts your judgment, they enjoy working with you. And at the end of the day, you leave that scenario and your work environment, I think, ultimately in a better and happier and more optimistic mood. So the third is kind of identifying your character strengths and then recognizing how you can use them. And there's a ton of research into the 24 character strengths that are listed here that really meet the metrics of things that can be beneficial to you. And I'm not going to read the entire list, but if you go throughout them, you know, you're not going to find each of these within yourself, but there's certainly things that I can attest to or part of my personality. So I feel like I'm fairly creative, I'm fairly forgiving. You know, I look for humility and humor in things. And if I can bring each one of those things into my engagements with patients and with my co-residents and with my faculty members, I think it really helps get the most out of that. And then it gets the most enjoyment out of your work.
Do I have to memorize that list?
You don't have to memorize that list. And then relationship building through effective communication. And I'll spend a few slides talking about this. So I think communication is everything. And remember, communication comes in so many different ways: verbal behaviors, nonverbal behaviors, your voice quality and tone, hand gestures, facial expressions, body movements. And there's ineffective and effective ways to do each of these. And the ineffective category is probably the one that you're most gonna geared yourself towards when you're in the throes of your PGY2 year and you're annoyed and aggravated and you have this high workload. You know, hopefully you're not cursing to people, but maybe internally to yourself. But in those interactions, you may give unwanted advice. You may criticize people. You may threaten or blame or be exaggerative, or ultimately you may even give ultimatums or be sarcastic or even refuse to discuss the topic. So take a step back and say, how can I approach this communication differently? And yes, you may sometimes have to put on a little bit of a different face that's comfortable for you, but instead try being thankful, try expressing empathy to that person who's calling that consult, being appreciative of their concern for the patient, expressing understanding of why they're concerned, communicating a plan, even if you're busy. Say, you know, I understand why you're worried about this patient. I am going to get to this. I promise. I have X, Y, or Z to do first, but I will be back with you in the next hour to give you a plan. And be objective in those discussions. And try to avoid anger. So if you just sit back sometimes in the resident room, watching people's communication, even in this great group of residents that I work with, you know, sometimes it can kind of boil over, and I watch them answer the phone calls or converse with other services. But again, how you have those interactions ultimately doesn't change the outcome of what's going to happen. That consult is coming no matter what. You have to see it no matter what. You have to staff it no matter what. So try approaching it with a different attitude. So think to yourself, I may not like it, but he or she is probably doing what's best for this patient right now. Think to yourself, okay, I have a choice about how I'm going to react to the situation. Realize that anger is not going to get me what I want. What I want is less consults, more time to do these other tasks that I have to do, but being angry isn't going to change that list of things that I have to tend to. And acting angry is not the same as showing that I care. Remember that you can be calm, you can listen rather than tell. You can say things like, wow, this is really interesting. Let me try to figure it out, even if your interest level really isn't that great. And then just remember, you know, hostility is bad for your personal health. So there's nonverbal signs you want to avoid: sighing, moaning, grunting, groaning. Your voice quality can be really challenging in terms of communication. If you're shouting, if you're tense, if you're mumbling, if you're snickering. So try instead to be calm, show inflection, speak clearly. And even in your hand gestures, or in this next slide, your facial expressions, those all have an impact on how you feel about those interactions, how you bounce back from certain situations. You know, if something doesn't go right and you have a really defensive attitude and your facial expression and your communication is one of defensiveness, you don't give the opportunity to engage in a conversation that may prove to be really educational and leave you feeling actually good about what you gathered from that and what you learned from it. And again, body movements have the same sort of effect if they're ineffective. And then there's these individual learning modules and resources that should improve wellness in all these separate domains. So emotional wellness. Emotional wellness is often linked to physical wellness. So if you're a program, try to provide a place that's devoted to physical fitness, that's accessible, or something that's accessible for meditation. If you don't have that within your own residency training program, I mean, with the era of apps on your phone, there's a variety of different things that you can personally do to do meditation, to do physical fitness. We just did a whole new resident wing at our personal program, and we have 2 Pelotons coming in, as well as some weightlifting gear, and it's accessible to them if they have an extra 10 minutes in between cases, or at the end of the day, if they want to quick get on the bike for 20 minutes before they go home. I think it's also important as programs, if there's anybody out there looking at this from that standpoint, to listen to your residents about what they think is going to be helpful. So when I first took over this role and I was trying to build wellness into our training curriculum, I had some preconceived notions that people would mostly get their outlet through physical fitness because that's what works for me. And I sent out, this is one of my favorite stories, but I sent out one of these surveys asking, okay, what do you guys want to do as a social bonding event? Should we do a cycling class, or should we do another soccer game? And then I had this blank line at the end. And I would say 75% of the people who responded put on that blank line that they wanted to go rifle shooting, which is something that I would have never in a million years chosen, and definitely gave me a high sphincter tone, and thinking of what could have gone wrong. But I was able to listen to them and organize it through some of our faculty members who have access to the Rod and Gun Club. And we had a really good time doing something that was totally outside the realm of, something that was physically fitness related. Social, try to do these team building events and maybe even think about implementing a resident wellness day. Family is super important. So partner with university or community resources to provide options for residents who may be experiencing marital or family discord, promote inclusion of families into these departmental events, make it feel like that family-centered feel that you want it to be. And then spiritually, so there might be places of worship locally that your residents may be invested in. Promote trying to schedule residents who have certain religious holidays, that they can have those holidays off so that they can participate with their family and their belief systems. And then even simple things that like looking for nutritional options for conferences or departmental social events that are representative of the people that are around you. So when I first started here, we had a specific situation where one of our new faculty members was very strict kosher, and we had a departmental meeting at a location that didn't have any options for him, and he had to sit there and not eat dinner while the rest of us did. So just thinking of some of those small things that you may not account for that can make a really big difference in terms of how people feel about, the wellness that's being shared and thought of within the program. And just some final thoughts. So include families when possible. The development of resiliency skills will not only benefit residents, but those that are with them as family members. We all know that residency doesn't just put demands on the resident, it puts demands on the family unit. And the inclusion of families helps provide departmental support and to show that family is a valuable thing to the department as well. Faculty should also be included when possible. So the psychological impact of practicing in healthcare doesn't end at the end of residency. And usually this train the trainer model works best, where if the faculty members are practicing under the same sort of resiliency model, then they can hand down those skill sets to the residents that they're training, and they can be a good demonstration of how to use those resiliency techniques in the throes of stressful situations. And then financial strain is something we don't often talk about, but it definitely has deleterious effects on overall wellness and resiliency. And formal neurosurgery training really doesn't give residents or even medical students education about financial wellness and how to transition into practice. So including seminars in some of your educational sessions about financial wellness and how to prepare for the future can be really beneficial. And these are just some resources that have some really good comprehensive information about whether if you have interest in building a resiliency program within your specific lifestyle or within your specific program. These are a lot of great resources to go to, especially the Penn Resiliency Program. They have this phenomenal program that they can really execute in any different sector, whether it's healthcare or aviation or the military. And they do offer that program nationwide. It is pretty labor intensive, so you have to commit to wanting to do it over several days. But again, just a lot of different resources that might be of interest to you. I think that's all I have for today.
Wow, another powerhouse talk. Thank you very much for two quick questions. One is, if you run into someone at a national meeting and this is a resident and they love your talk, they want to institute something like this in their program or in their personal life, but they say that their program is traditional, resistant to these kind of concepts. What would you suggest they do?
I think you have to start slowly. And to be honest, it's something we've slowly built into our curriculum as well. I think it started with the recognition that some of these team building events were really valuable and beneficial to just the team camaraderie and, over everybody's overall just optimism and morale. So we started engaging more in those over time, from the soccer tournament that Dr. Levy mentioned. We started doing the New York City softball tournament, which was a huge team building event. We started doing some social events with the residents. And I think seeing the positive influence that had, it just gave me more interest in trying to make this a staple of our training program, which led into the development of the resident space and then the physical fitness center. And, by no means are we reducing our expectations for the residents. We expect them to maintain a high level of consistency in their work ethic and their academic endeavors and their publications, but we want to support their mental health as well.
I would almost say that allows us to increase our expectations. So while we provide them, kind of like Google, right? We provide them a nice space to shower and work out. They never have to leave now. No, I'm kidding, all kidding aside. But as Renee said, some team building outside the hospital will break down barriers of resistance, whether it's soccer or doing a spin class together or just a social, some type of social event, but offsite builds trust, builds a camaraderie, and then I think slowly weaving in some of these implementation strategies, it's probably the most effective way.
Quick part two, and then I'll let the other panelists ask you their questions. How do you incorporate these concepts into how you select residents? I mean, you, Dr. Levy, you talked a lot about the characteristics you think neurosurgery residents should have, and then we have the resiliency aspect.
I think their backstory is so important, and even more so when you're interviewing. I know you have a lot of young residents on this call. I think when you're applying for jobs, whether it's residency or especially career, your backstory is going to be real important. Did you put yourself through college? Did you play a team sport growing up? Were you self-made? What kind of discomfort did you experience that helped create a foundation of grit and resilience? What have you done for others? So when I'm interviewing people, sure, board scores are a metric and letters of recommendation are a metric. But at the end of the day, and I think Dr. Janetta talked about this, your backstory, that is sort of your foundational creation. And I find that to be very important.
Yeah, thoughts, Dr. Reynolds, our program director on the call, how you incorporate this in selecting residents?
I think one of the more common questions that we ask is to tell us a time where you faced adversity and how you reacted to that. And if somebody struggles to come up with a situation, or if their response doesn't really show that they had to put in critical thinking and come up with a solution, that's certainly a red flag. I agree with Dr. Levy that I think your foundation of how you got where you are says a lot and speaks volumes. I think you don't necessarily have to have played a D1 soccer, but if you are a competitive chess player and you've really invested yourself into something outside of medicine that requires those strategy and resilience and critical thinking skills, it is hopefully telling that will translate to other areas as well.
Excellent. All right, so I think next is we try to go from more senior to more junior, typically with these questions. So I believe Neil is our next most senior person, PGY6. What are your thoughts, Neil? Questions, comments, discussions you want to have?
Thank you both so much for a great talk. I really enjoyed. Can you hear me okay or no?
A little distant. Yeah.
Is this better?
Yes.
All right. Thanks so much. I really enjoyed listening to your talks, both of them, and I think this is an important topic that we really don't talk too much about in neurosurgery. We talk a lot about aneurysms, pathology, and all that, but this is based from the literature that you publish. This is clearly something that's important to surgical training and neurosurgical training as a whole. My question was along the lines of Dr. Johnson. I'm going to ask, what do you look for in applicants? But, people always talk about grit and resilience being a nature versus nurture kind of thing. So if you have an applicant that's in your program that you've already selected, what are some of the things that you can do to help them become more resilient, to develop that grittiness that you look for in a resident?
Yeah, I mean, without telling personal stories, I certainly have had situations where people are struggling in certain scenarios, whether it's, professional behavior or keeping up academically. And I think one of the big things you have to do is sit down with that person and understand the root of where the challenge is. Is it a time commitment issue? Is it a retention issue? Is it a stress issue? And then you have to use each person's individual situation to come up with a specialized program or pathway to help them in whatever way that is. So you can't just silo everybody into, well, these are the things you need to work on. Everybody has different family situations and outside stressors that can be influencing it. So I've worked with residents who had trouble keeping up academically and helped them develop a schedule and be accountable to that schedule in terms of their learning and keeping on track. I've had folks who've had trouble with professional behavior and talking about a lot of the communication things that we just discussed. And it sounds silly, but kind of counseling them and giving them certain situations and tell me how you're going to react to that now, just to prepare them. And it doesn't always lead to perfection, but I think it helps give them some skills and tools to lean upon when they need it in those scenarios.
Yeah, and I think we have a very good balanced approach. And this is going to sound potentially crude and oversimplified, but sometimes it's a push-up approach or a pull-up approach. So we have a pull-up bar in the resident office, and sometimes I'll walk by and I'll be like, all you guys on the pull-up bar, and we'll go from least recorded to most recorded. And, you know, I can do around 20, and there are very few residents that can do more than 20. But the point is, I say by the end of your PGY 1 year, I expect you to be able to do at least 5 pull-ups for the men, just because genetically men
I
can do more.
8, so you're good.
There you go. She can do 8. But grit, sometimes sometimes you sort of have to go outside the box. And just as long as they're working towards something that is challenging, when you build grit in one area, so this is not going to be in a mental area, right? But it's just going to be, you're pushing yourself out of your comfort zone. You're uncomfortable. And if you can't do 1 pull-up, and I'm telling you, by the end of the year, you're not going to PGY 2 year if you can't do 5 pull-ups. It's amazing how everyone can do 5 pull-ups by the end of the year. But it's sort of when you dig a little below the surface, there is a method to that. And it's, hey, let's do something. I expect in 6 months, you're going to be able to do a task that you can't do today. And it's not about the 5 pull-ups. That's symbolic, because I'm going to expect in 6 months that what you can't do in the OR today, you're going to be able to do something well beyond that in 6 months. And what you can't write today, in 6 months from now, I expect to see an article or some sort of writing progress. So for me, it starts with a simple task, showing the resident, wow, look what you did. You couldn't do this before, now look at you. And just if you can do it here on a pull-up bar, you can do it in the OR, you can do it in the lab, you can do it in publications.
Joey, do you have any thoughts or questions for the group?
Yeah, so again, thank you so much. This was wonderful, something that a topic that I really like talking about and thinking about. So I want to get your thoughts. One of the things that I guess struggle with or think about is, in my mind, grit is sometimes synonymous with, a grind, being able to put your head down and just get to work and doing it. And I would love your thoughts on when that kind of transitions to, because certainly that grit could be taken to an extreme that is no longer healthy because you're actually going down the wrong path, right? And so at what point do you know that you need to transition your thoughts to something different because the path is difficult because it's not really the right path for you, versus you just need to get grittier and you just need to get your head down and work harder?
That's a great question. Did you read Grit, by the way? Great book.
I have, yeah, I really enjoy it.
So I kind of use one of the vignettes in the book is they have somebody run their best mile on a treadmill, and they say, hey, do you want to come back and try it again tomorrow? And sort of the gritty person says, you know what, this was my best, but I'm going to try it again. Maybe I can do better. The non-gritty person will be like, you know what, this is good enough. But to answer your specific question, yes, just because somebody has a desire and a passion doesn't mean that they're necessarily going to be successful in that arena, right? Look at my son. He wanted to play college hockey. Not going to happen, no matter how many hours on the ice he spent and no matter how many times he shot pucks in the net. That's not why God put him on this earth. So I think there's a balance of understanding the cues around you, talking to mentors, talking to people in the space, and listening to those cues and saying, hey, does this make sense? Am I not here? Do I need to work harder to get where I want to be? Or is it a question of work ethic, or is it a question of aptitude, right? And I think being honest with yourself and sometimes getting somebody objective, somebody who's not just looking in the mirror, but somebody from the outside looking at you who's kind of a few years ahead or senior in the field to help answer that question is an important question. Sometimes it's not a question of work ethic. Sometimes it is a question of aptitude.
Yeah, and I hate the mentality that grit means put your head down and just do it. I don't really think that's what grit is. I think grit is facing something that's challenging and making the decision that you're stronger than the people who have given up, and it means enough to you that you want to push forward. And in doing so, there may be some struggle and there may be some pain, but you're going to be so happy when you get to that other side that it's worthwhile. And I think it's really about that happiness on the other side. So if you get there and the path was worth it, and the muscle fatigue, or, if you're training for a marathon, the muscle fatigue and the joint pain and all that stuff is temporary, but allows you that elation and that fulfillment, then it's worthwhile. But if at the end of that marathon, you can't get up the next day and you're miserable and you don't feel fulfilled, well, that really wasn't worth it. It probably time to stop pushing yourself.
So Joe, just to parallel or piggyback on that, we talked about the book Grit. Have you seen the Rocky movies?
Of course.
All right. So what does Rocky Balboa say about, not necessarily about grit, but one of the quotes in the movie, right? And I'm going to paraphrase the quote a little bit. Doesn't matter how many times you get knocked down, matters, right? How many times you get up, right? I think he said, you can knock me down 7 times and I'm going to get up 8, or whatever the quote is. But that, to me, that's grit, right? As she said, it's adversity. It's being, I'm going to continue to push forward because that is my destiny. That is my passion. I'm not going to let an obstacle stand in my way. Obviously, everything has to be in some balance. But remember, balance is, what is another word for balance? Middle. So nothing great, and we argue about this, nothing great, exceptional things don't happen in balance. Einstein's life was not in balance. People who are gold medal marathon winners or gold medalist swimmers, their life is not in balance, right? Anybody who achieves something that's excellent often has to make a temporary sacrifice and take their life out of balance. And that, I think, is important in a world where we hear about balance. Sometimes we need to get out of balance to achieve something great.
I think that
Very inspirational. Thank you.
That's absolutely wonderful. I'm very curious because that transitions really interestingly into a question that I had. Now I'll take another turn, if I may, which is your slide about who experiences burnout. And is it people that have families and social support and things like that, which I think is really important, but also those people are probably very much impacted about life being in balance, albeit, for a certain period of time during training. Is there any actions that you guys have taken or you've seen other people taken about keeping their life, in a particular order when they come into residency, that they're going to be more resilient or they're going to prevent themselves from having burnout, et cetera?
I don't know that I have a great answer to this question. I think I do want to mention that I think balance is different for everybody, and only you know whether you're in it, right? So I think my life is very balanced. Most people who look at me from the outside think I'm insane. I don't think it's different or, exceptional. It's just what works for me, and it's what makes me happy at the end of the day. But balance is going to look very different to somebody else. So I don't think as an outsider, we can look at somebody and help them define whether they're balanced or not. I think they have to know it themselves, and there has to be fulfillment on all ends. And I think one of the things to learn as a resident, and it's hard, and you're probably going to disagree with me, but there's so many things to say yes to, it's never ending. But if you say yes to everything, you can't be good at everything, and you're never going to be able to get to that balance. So it's a hard thing to do, but you have to learn what you can say no to, what you should say no to, and how to optimally manage the things that you do say yes to. And I think that's where you find that balance. And it's hard because people are always going to want and expect something from you. I still struggle with that.
I'm going to give you a mathematical formula that I think I developed, but if somebody fact checks me, I'm happy to give credit. It's D equals E minus R. Disappointment equals expectation minus reality. So if your expectation is high and the reality is low, that delta is your disappointment. D equals E minus R. Now, if your expectation is low and you over deliver, that's a negative disappointment, which is elation. So you're happy. So to Renee's point, I think people need to set appropriate expectations. It's another way of saying over deliver, under promise. But I also say you only get one chance to say no, and they're not going to ask you again. So people will ask you to give talks like we are tonight. People will ask you to travel. And I truthfully tell the residents, when you are building or you're trying to make something great, you get one chance to say no because there are 1,000 other people that are right behind you dying for that opportunity. So we live in a world where balance is the PC right way to do it. But truthfully, as Renée said, she may perceive her life in balance, but any other person looking at her life, raising 5 children, program director, excellent academic pediatric neurosurgeon, colleague, friend, people think she is insane. I think she's perfect. So, her crazy works with my crazy, I like to say. But yeah, I think it's to the neurosurgeons on this call, embrace, you'll hear other people say this, embrace the discomfort. Embrace the discomfort because I'm not, this is what one of the Peloton instructors, my favorite one, Emma Lovell, she'll say, embrace the discomfort, that's your body changing. And I love that because that's true in surgery, or it's true in neurosurgery. Embrace the discomfort, it's you growing. And that doesn't mean forever. It's just a temporary state of imbalance to bring you to a new state of improvement.
Love that. Excellent. Neil or Joe, any other questions you guys have?
Very inspirational. Yeah, one of my favorite quotes in medical school that I put up on my wall was one of Muhammad Ali's quotes, and I hope it's Muhammad Ali's because that's what I've thought this whole time. I hated every single minute of training, but I said to myself, suffer now and live the rest of your life as a champion.
Love
And
great
that got me through step 1 and all that, and I still have it up on my wall now. But yeah, so very inspirational talk by both of you. And one of the biggest things that I got from both of your talks is how intertwined resilience, grit, the topic that was the name of our webinar, and wellness are. And Dr. Reynolds' talk really, I think, tied that in together about how important wellness is in terms of being able to keep that grittiness and staying resilient. So, and I think that sometimes is lost. So,
well, thank you guys.
Any other last thoughts?
Just thank you. I mean, that was extremely inspirational. Yeah, perfect.
All right, Anna Rodriguez, our medical student. There's not all that many questions that we haven't already answered in the chat box. But any other questions that you might have, Anna?
We have one question only. Are there any specific recommendations you have for DO applicants?
For a neurosurgery residency, I assume. Yeah.
In what regard?
I think this is probably a medical student interested in matching in neurosurgery who's is in a DO medical school, is my thought.
Play to your strengths.
Yeah.
Play to your strengths. Nobody cares. DO, MD, those days, I honestly think those days are history. Be exceptional. Be an exceptional candidate, and no one's going to care if there's an MD or a DO after your name.
I agree.
Yeah, it goes back to those characters that I mentioned, find your strengths and use them. We all have them. We all have weaknesses, but find your strengths and advertise them.
Why would you say we all have weaknesses? Why?
Like, why were you looking at me when you said?
Yeah, I know.
But what I would tell this person also is that we had a webinar specifically on like the metrics that get you to match in neurosurgery. And I think if you, like you say, you played your strengths, not only that, but your grit, you have go-gettedness, you're strong, and you get all those metrics. If you need to take time to get to know a well-known researcher in the field and spend time with someone, et cetera, to get the recommendations, do away rotations when COVID is gone, then I think that you become as competitive as anyone else. But it's about the people you know and how quality of a candidate you are. So I agree that I don't think that there's a particular, anti-DO stance in any program I've been affiliated with. Excellent. All right. Well, I think then with that, we're going to wrap up. I have a little share screen outro if you guys will indulge me for just 1 minute. I appreciate your time. Absolutely excellent talk. I personally learned a lot. I made it through residency. I learned that maybe I had some grit. because it certainly had its ups and downs and challenges. A string of Q2 calls for a few weeks, I remember, was tough. I had a lot of those burnout points that you had on there, so that's wonderful. So next week is our next episode. It's actually episode number 8 about spine surgery, and it is not next week, it's the week after, as I mentioned earlier. We have next week off for Thanksgiving. We have a wonderful, long-standing AANS staff member who was on our committee who has recently retired this year, named Chris Phillips. We have started an NREF fund in her honor and to advance medical student mentorship, research, and education, and participation in organized neurosurgery. A lot of the medical students who watch these webinars ask how they can become more involved in young neurosurgeons webinars and or in young neurosurgeons in general. And we're working on expanding that portion of our committee. So be patient, and we will start to have more positions for you. But in the meantime, part of the way we're going to honor her is by funding some of these things with donations. All of these webinars are recorded. They're eventually edited and placed on the NREF YouTube channel. There's a series of them that are up to now number 7. And you can see the announcement of when those are posted on social media. Again, we have an Instagram and Twitter account, or you can just Google YNC and NREF webinar series, and you'll find them. Please follow us on social media. For anyone watching who has more questions, suggestions for future topics, etc., we have an email account for the webinar named webinarync@gmail.com. You can reach us there. And that pretty much concludes things. I really want to thank Dr. Reynolds, Dr. Levy, Dr. Majmundar, Ms. Anna Rodriguez, soon to be MD, Joseph Linzey.
Congratulations.
Thank you for everyone for your time and energy. And I think it's an amazing topic and a very much well-needed one. I learned a lot myself. And I hope you all have a wonderful rest of the evening.
Bye. Thank you.
Thank you.